Welcome everyone. I'm Sade Jones. I'm from Penn Policy Center, and I want to know where everyone is from and also how this big ugly bill affects everyone's families. You're welcome to put that in the chat.
Sade, I know we have a ton of people who are still joining because we had so many people who RSVP'd to this. Do you want to introduce yourself again and ask that question again, and we can prompt folks to share in the chat?
Yes. Okay. Hi, my name is Sade Jones. I'm a regional organizer here at Penn Policy Center, and I would love to know where everyone is coming from. Put it in the chat, and also how this big ugly bill affects your families. 107, 108, the numbers just keep going up.
Welcome, folks. We're going to get started here. I'd like to introduce or allow him to introduce himself, our Executive Director for the Pennsylvania Policy Center, Mark Steer, and he'll introduce our special guest.
I didn't know I was going to do that. Thank you, Dwayne. I'm Mark Steer, the Executive Director of the Pennsylvania Policy Center. We have a special guest, Senator Chris Coons of Delaware. We've been very pleased that he's been spending a lot of time in Pennsylvania in recent days and weeks. Some of you may know there's a history of senators from Delaware adopting Pennsylvania. We thought it was because Senator Biden grew up in Scranton, but now it appears that the great senators from the state of Delaware are too big for their state and want to expand their presence. And we are very, very happy to have Senator Coons being so active here talking about this terrible legislation. So with no further ado, Senator Coons, happy to hear from you.
Thank you, Mark, and thank you so much to everybody for the chance to be with you today. This has been a really hard week, and I know Congresswoman Mad Dean was going to be joining, but she's still on the floor as Leader Jeffries is continuing his, I think now 7-hour filibuster. I guess we filibuster in the Senate, but he's giving a long and detailed speech about the impacts, the very real world impacts on families, on working people, on seniors, on the disabled, on newborns, on rural hospitals, on urban hospitals of this big, ugly bill. As I suspect many of you know, in the Senate, we had the longest filibuster in modern history, the longest reconciliation bill. We call it vote-a-rama. We keep voting on amendments until we have exhausted our ability to keep voting, and we voted on more than 45 amendments. One of the amendments that I was able to put forward and get a vote on essentially challenged the Republicans to take out red tape that is going to deny Americans access to health care, to tax credits, to SNAP, to other vital programs. It was defeated on a party line vote, like dozens and dozens of other amendment efforts in the Senate. It's important for us to both take a step back and look at the bigger picture and then zoom in and look at who's actually impacted. 500,000 Pennsylvanians will lose health care, both through the expiration of the tax credit that makes the Affordable Care Act affordable and through these new paperwork requirements for Medicaid access. This is going to close hospitals. This is going to impact families. Just last week, I met with 30 nurses from Delaware who came to visit with me because their patients can't. They care for newborns. They care for disabled Delawareans. They care for seniors in nursing homes. They care for their own family members. And Medicaid is the single largest source of funding and care for all those different groups. Last night, I talked to a doctor at CHOP, the Children's Hospital of Philadelphia, who shared with me that 40% of his patients depend on Medicaid for their care in his hospital. And his prediction was that St. Christopher's Hospital in Philadelphia will be one of the first to close. So whether it's in Pittsburgh or Philadelphia, in Erie or in Scranton, in rural areas or in urban areas, we are going to see real human suffering as a result of this bill. And let's just take a moment and remind ourselves why. What's the goal? This is to extend deep tax cuts for the very richest Americans and the most profitable companies. So billionaires will make out big time, but working Americans will lose. Even with some small and temporary tax breaks on things like tips and overtime, the net, the analysis being done by important centers like the Penn Center makes it clear that this is a punch in the gut to the American middle class. Yesterday, I was in Harrisburg and I joined teachers and social workers, local county employees and state employees from AFSCME, from SEIU, from PSEA in a roundtable to challenge Scott Perry, the Freedom Caucus congressman from Harrisburg, to stand by his stated principles that he's not going to add to the American deficit and debt and vote against this bill. This bill by CBO scoring is going to add at least $3.3 trillion to our national debt over the next decade. And it was no surprise, frankly, that Scott Perry nonetheless voted for the bill after expressing concerns. I'm committed to an effort to hold Rob Bresnahan and Ryan McKenzie and Scott Perry accountable for their votes for this bill, and to work with the state and local party and candidates in Pennsylvania to make sure that they have access to the best advocacy, the best analysis, and the best organizing so that there is some consequence to the incredible cost of this bill. Mark, thank you for the chance to be with all of you. I'd really welcome a chance to take questions. The folks who are on this call know more than I do by a lot about the actual real world impact on folks in Pennsylvania and what we can do together.
Yes, thank you, Senator. So, folks, if you could put some of your questions in the chat. We only have Senator Coons for a short period of time. He needs to jump, as you can imagine, with everything happening in DC right now. But feel free to drop your questions in there. Right now, Senator Coons, what I'm seeing is a lot of comments about the impact that it's going to have on families. Renee Berger says that her mom's 93 years old and she survives on $400 a week. And the questions are there, like, who are we going to tell her? Like, how are we going to help her? You know, and what we can do to basically mitigate these things. And it looks like there's some other questions that are coming in too.
I am to a couple of comments and questions I'm getting here in the chat. I am looking forward to going back to the 8th district, to the 7th district, to the 10th district. These are U.S. House of Representative districts centered on Scranton, Allentown, Lehigh Valley, and Harrisburg, where the incumbent Republican House members voted for this bill and were elected by less than 1%. So they had the members of Congress who beat Matt Cartwright and beat Susan Wild, friends and colleagues of mine, won by very narrow margins and are in their first terms. And Scott Perry won by a small margin. And I am optimistic that Janelle Stelson, who ran last time, may well run again, who was a longtime anchor at WGAL in Harrisburg. So let's hope that we have a positive and engaged primary season that produces strong candidates. And frankly, that we get more clarity about our candidates for the upcoming midterms. I'll look at some of the questions here. Yes, Rob Bresnahan needs to be a one-term representative. I couldn't agree more, Jessica. A question from Daniel is, how can Democrats communicate how terrible this bill is to the public, especially more conservative audiences? So let me answer that for a moment, if I might. One of our challenges is pushing back on Republican disinformation. Their argument about the Medicaid impact, from President Trump to Speaker Johnson to Leader Thune, is that all they're doing is throwing people off of Medicaid who don't deserve it, either because they are undocumented or because they are refusing to work. And it's important to have your facts straight and to be able to convey them concisely and briefly, which can be hard to do at times, particularly when you're talking to folks who just aren't going to believe or listen to your analysis. The federal rules are that Medicaid money, federal Medicaid money, cannot be used to provide services to people who are not here legally. It is state programs that have decided to expand the reach of their state Medicaid partnerships that are using state money to provide health care to people who are in the United States without documentation. So, for example, in California, Medi-Cal, which is their state healthcare system, uses California state funding to make it possible for people who are in California but are not documented to access healthcare. The simplest argument, so A, that's not what's happening with Medicaid money. B, they're punishing states that have made a state decision about expanding healthcare. Weren't the Republicans the party of states' rights? Last, in terms of efficiency and basic human suffering, everybody who gets sick and desperately sick and has no alternative ends up in the emergency room. Because of a federal law and common decency, emergency rooms don't turn anyone away. Our emergency rooms in Delaware are already overcrowded, and I'll bet yours are too in Pennsylvania. Having Medicaid dependent hospitals close, having people afraid to go for health care because they're now unsure whether their status in terms of documentation will lead to them being deported, and having states not able to supplement Medicaid just means more sick people who come to the emergency room when they're sicker and who are more likely to impact the healthcare and the costs of everybody. So that's an attempt at a concise argument. Who else has got a question that you'd like me to answer?
Senator, I have a question that reflects some things I've seen in the chat. I think many of us believe that just as the 2017 tax cuts led to a drastic change in the next election, that will happen in 2026. But people are worried about whether we're even going to have free and fair elections in 2026. Does that concern you? What can we do to ensure that our elections reflect the will of the people then?
Mark, that is a concern of mine, whether directly or indirectly, that there will continue to be efforts to undermine the vote, to undercount the vote, to influence the vote. Look, one of the things that's hanging over us is that President Trump relied on X or TikTok and his partnership with Elon Musk to influence the outcome of the election. As I was driving all over Pennsylvania doing lots of local events, for the Harris campaign, I was struck at how little local organizing there seemed to be on behalf of the Trump campaign. Well, it was all happening on here. They were doing the vast majority of it digitally. If TikTok, which is currently under a binding legal decision upheld by the courts to be sold, Trump has just made up the idea that he has the power to delay its sale. If TikTok is sold to an organization, a group, or an interest that is aligned with Trump and uses the power and the influence of TikTok the same way that X was used, that could have a hugely negative influence on the next election. It is entirely possible that there will be efforts to prevent our having an election. And I think the folks who are on this call are right to be concerned about it, to be vigilant about it, and to be engaged. There are also, unless I'm mistaken, state Supreme Court elections this November in Pennsylvania. And knowing that there is a majority on the state Supreme Court that will act to enforce election laws and to ensure a free and fair election this cycle is a pretty important short-term goal for anybody interested in making sure that we then go on to have full elections in 2026.
Thank you. If you have time for one more, I see Jeff Eisman, who's a frequent visitor with us and works in
Happy
this area.
to. Yep, happy to.
He's asking a question about the impact of the bill on Medicaid waivers, state managed care programs, and Medicaid transportation for people with disabilities, or the impact of the bill on people with disabilities in general.
The impact on people with disabilities generally will be very harsh. And because people with disabilities rely so heavily on Medicaid for their funding, and the bill, certainly as it came out of the Senate, which means how it was passed by the House, this bill layers all sorts of additional requirements for certification and recertification. It both reduces reimbursement rates and increases compliance audits and certification paperwork. From what I've heard early, from the analysis from hospital leaders and from healthcare providers here in Delaware, there's going to be a huge impact on the ability of healthcare providers to actually deliver care. They're going to waste a huge amount of time and staff and money on complying with paperwork in order to be able to continue to be reimbursed for care and get much less money to deliver that care. Some of the specifics you're asking about, transportation for the disabled, for example, I don't know enough about. But I'd be happy, Mark, to consult with Katie Pinnell in my office, who is very informed about the specifics of the bill and how it impacts certain populations, and get back to you and get back to anyone with additional questions.
Thanks. And Jeff, I can talk to you about that as well.
Okay. Mark, if I could just express my gratitude for everybody who's on this call. Pennsylvania is the Keystone State. It is the absolute turning point for our upcoming elections. We can't be successful in taking back the majority in the House or in electing the next president of the United States without Pennsylvania. I hope and I know that you do this because you care about the impact on people, the folks whose lives are going to change in ways they may not even appreciate because of these obscure procedures in Congress, reconciliation, and so forth. It is sometimes hard to explain to folks exactly what's coming. And the president is really very good at distraction, at saying, no, no, look over here, look over here. No tax on tips. This is going to help you. When in reality, working people are about to get screwed and screwed in some of the worst ways imaginable. For the first time in my lifetime, we will move backwards dramatically on access to healthcare. America will be poorer, sicker, more divided, and less great as a result of this bill, which I suspect will soon pass and become law. And for me, the only consolation will be having the opportunity to hold Republicans accountable because only Republicans voted for this bill. When Democrats had the chance to use this same vehicle, reconciliation, we did three things. We passed the Affordable Care Act under Obama, and we passed the Inflation Reduction Act under Biden, which reduced the price of prescription drugs and invested in clean energy manufacturing in this country. Democrats have the opportunity. We expand healthcare, we reduce prescription drug prices, we invest in manufacturing and clean energy. What have Republicans done? The 2 times under Trump they've had the chance to do this, cut taxes for billionaires. They have thrown this assault on Medicaid as a gratuitous additional slap, and they've cut SNAP dramatically at the end of the day so they can fund deportations and fund the military. I voted against this bill proudly, and I look forward to working with you to campaign against those who've supported and advanced this bill. Thank you.
Thanks very much, Senator Coons. We really appreciate you being here today. And we look
Great being
forward
with
to
you.
working with you in the future.
Thank you, Senator Coons. Mark, I've been having some real challenges with my video here. I'm turning this off. An update about where we are right now, impact on the state, and then I'm all queued up to talk about the hometown fight back when you're finished.
Okay, thanks, Dwayne. So I'll talk for a few minutes about some aspects of the bill you know about, some you may not know about. Look, let's. We're at this point we're pretty sure it's going to pass, so let's talk about it as if it had. This is just a morally and economically bankrupt bill. There's so much horrible about it. We've been talking a lot about the shredding of the safety net, deep cuts to Medicaid, the ACA, SNAP. That's going to bring physical pain, economic distress, and frankly, thousands of premature deaths to the people of Pennsylvania. 500,000 people in Pennsylvania are at risk of losing Medicaid, 400,000 to 1 million at risk of losing SNAP. There's much more too. There's the efforts to repeal of the efforts to address climate change, which will lead to more natural disasters and economic dislocations. People don't know how effective the Biden plans has been in shifting us to renewable sources of energy, which are now the cheapest forms of energy. If we block that, as this bill does, our efforts to generate more electricity without harming the environment and leading to climate change are going to be slowed. We're going to face electricity shortages. There's the extraordinary shift in income and wealth to the ultra rich and the wealthy. a huge increase in deficits, which is probably a good thing in a time of economic decline or war pandemic, but which is a very bad thing when the economy is going along well. You may not know about the disgraceful defunding of healthcare organizations whose services include abortion, such as Planned Parenthood. And this bill also contains, for the first time in our history, a national school voucher program, while Trump also makes deep cuts to federal support for our schools. Keep in mind, these policies are not popular. They're not even popular with the Republicans who are voting for them. It's the product of a deeply ignorant and profoundly malevolent president who's come to dominate this Republican Party with political threats and financial bribes that have so far not been constrained by the Constitution of our laws. Many members of the Republican know, some have even said out loud, that this legislation is not only deeply flawed, but contrary to their own principles. Yet Trump's hold over his fascist cult following, his willingness to act beyond the law, has left them so afraid and led them to bow to his wishes. Now, I want to say something about all of you. The people of this state have fought back. We've seen an enormous grassroots effort led by organizations like ours and many others, SEIU, FAN, all kinds of organizations have been stepping up, including all our partners in the Pennsylvania Together campaign. I see Action Together NEPA here right in front of me on my screen. I want to particularly shout out them. They've done incredible work in Northeast PA. I'm really proud of them, of our staff, and all of our activists who devoted so much time and energy to educating people about this legislation. But the power of Trump's hold on the Republican Party is so great, even though some Republicans who know how deeply wrong it is voted for it. But look, we know this is a fight not just about this bill, but about political and moral fundamentals, about protecting the safety net, restoring economic equity, protecting education, the climate, and so many other things, but also about democracy itself. And that's why I raised that question about whether we can protect our democracy. And I know we're all worried about that. I fear not just TikTok, I fear the National Guard and Army in our streets on Election Day in 2026 and 2028. But I want to tell you why I think we can survive this. First of all, we got to remember that federalism does protect us. Elections are run by the states. As Senator Coons mentioned, we have a critical Supreme Court election this year. The Supreme Court, with its current occupants who have protected our elections, have ensured free and fair elections in Pennsylvania. Similar battles are being carried out in other states. And in those states, there are enough states run by people who want free and fair elections to ensure that we can retake the House in 2026 and that we can retake the presidency and the Senate in 2028. But it's not just that. I think we're all coming to understand that all these fights are tied together. We understand that we're fighting for a representative democracy because it is only representative democracy that can enable us to create a government that serves the people, not the billionaires. The fight for democracy is deeply tied to the fight for the safety net, for economic equality, for efforts to mitigate climate change, for the rights of Black people, women, and the LGBTQ community, and for decency to immigrants. As we understand how these are all tied together, we're going to be ready to fight back for our democracy. If the Army and the National Guard are on the streets, I don't think that's going to stop us from going to the polls. And I think our local political leaders are going to protect us and protect the voting because we are going to demand them that they do so. So look, we are in a really hard moment in this country. I was reminded this morning of what Abraham Lincoln said in the Gettysburg Address. The question for us really is whether government of the people, by the people, and for the people shall perish. It's in our hands whether that's going to happen or not. So I know a lot of you are despairing right now. I know a lot of you are exhausted. I know a lot of you cannot believe the moment we're living in, but I want to just urge you all to keep fighting. Take the breaks that you need them. You can't do this 24/7. We all need to take a little time off, spend time with our families, spend time in nature, but stay engaged in all this work because if we stick together, if we all work together, we will have free and fair elections. The Republicans have extraordinarily overreached because they're listening to the madman in the White House. They've done things that the people of this country simply do not want. And our next elections are going to reflect that. And when that happens, we'll be able to turn the country back in another direction. So I really want to thank all of you. You wouldn't be here in this call if you haven't been working really hard since at least January or before that to be part of this effort. So thanks so much for everything you're doing. Dwayne has some things he wants to tell you about things you can do next. But if there's some particular questions you want me to answer about the legislation, I'd be happy to do that before we turn it back to Dwayne. I'm looking in the chat now. Someone says, not exhausted, fired up. Great. That's what we have to be. Someone said, well, our representatives don't reflect the people. That is true. You know, once they get in the office, they do what they want to do. We can try to influence them, and I think it's really important that we do. Not just whether they agree with us or not, but because everything we do to try to influence our representatives that we do in public shapes public opinion. We do all this stuff calling out Bresnan and calling out McKenzie and calling out Fitzpatrick and McCormick, not just because we think we might influence them, although sometimes we do, but because by doing that, we are shaping public opinion. I want to tell you something. Right now, this bill is deeply underwater. In 2017, we weren't quite there yet at this point. We built opposition to the tax cut of 2017 over months and over a year. We're going to have to do that again, but we are far ahead because of all the work we've been doing to demand that our representatives listen to us. So don't worry if they didn't do what we said. You know, when we started this campaign, our goal was to stop it if we could, to make it less bad. And by the way, we have made it less bad. All the work you're doing out in public has helped me negotiate with some of our political leaders and get them to back away from a couple of things that were really even more horrible. So there was this thing that would have killed EITC, but because they're already afraid of what you're doing in the streets, I got Senator McCormick to fight back against that. So we've made it less bad. But the most important thing we've been doing is to make it deeply, deeply unpopular so that will shape our future elections. So representative democracy isn't about our representatives just doing what we say at any one moment. It's about the whole process. And you've been playing an incredible role in that process by shaping the circumstances under which the next election it will take place. Other questions? Let me see. Yes, Sean Towitt points out the cuts to Planned Parenthood do not affect abortions. The federal government has never paid for abortions. What they're doing is basically saying any organization that provides abortions cannot get Medicaid reimbursements. Planned Parenthood does an enormous amount of health care for women in this state and in this country. This bill cuts that off, and it's absolutely horribly shameful and will be deeply, deeply damaging to healthcare for women everywhere. I think we're going to have to, this is one area, and there'll be others I'll be talking about over the next couple of months, where we're going to have to go to our state government and say they need to pick up the ball and help us sustain these organizations over the next couple of years while we're waiting to reverse this bill. Anyone? I'm trying to scroll here to see other questions that someone asked, do we have a real-time tracker? People who have SNAP, Medicaid, hospitals closing, rising debt. We will be reporting on, yes, the state government will keep track of all that stuff. Follow our website, because as the numbers in Medicaid go down, we'll be reporting on it. Same thing with SNAP. We'll be pointing to hospitals that are closed. Some of this is not going to happen immediately, although frankly, the Senate bill is worse than the House bill because it moves up the date at which this happens. But some of even the noise about this bill is going to dissuade some people from getting Medicaid. And I expect we'll see those numbers start dropping. So we will be reporting on that, and you can look to us for that information. I won't say it's real time. We're not going to update this every 10 seconds, but every month or so we'll look at those numbers and we'll report it to you.
Mark, there are several folks in the chat who have asked a question about, and you sort of talked about this a little bit in your answer at the last question. When are we likely to see some of these impacts of these cuts to these programs?
To be honest, they kept changing the date, and at the moment, I don't remember whether the Medicaid stuff happens in 27 or 28, or 26 or 27. I think it's 27. But as I don't think they pushed it back to 26. It was originally 28. So some of it's going to happen after the next election. But I know someone's worried. Well, they're not going to feel it, so it won't affect people. The way politics works right now, given the dominance of social media and media in general, is that we don't have to wait for people to lose Medicaid for them to start worrying about it. They're worrying about it now. And the other thing to keep in mind is, we talk about 3 million people on Medicaid, but it's not the same 3 million people year after year. Medicaid is a program that's part of the safety net. It's for people who get into trouble, need some help, or for people of opportunities. I keep telling my daughter, who relied on Medicaid for health insurance when she went to graduate school. So there are people now who are worried about what might happen in the future. They may not be on Medicaid, or are thinking about, can I afford health insurance if I go to graduate school? The worry is there. It's palpable. It will affect how people look at this administration and these members of Congress even before the effects happen. People get angry when rich people get tax breaks, and they don't feel them directly. They just know it's happening, and they know it's wrong. So as long as we keep talking about what's going to happen, as long as we keep reminding people that they're suffering, and that the suffering is going to increase, and that there are premature deaths, and that's going to increase, we will have an influence on the election. It'll undoubtedly get worse when these things really hit, but it's going to affect people long before the first person loses Medicaid because of this bill. If anyone else on my team sees questions I should answer, it's hard for me to talk and read the chat at the same time. Yeah, Jeff.
Yeah, there's another question in there from Donna. Will the big ugly lie kill tax credits for green energy? And then there's a follow-up question from someone else noting that the Pennsylvania Constitution has in there, we have a right to clean air and clean water. And is there something we can do about that?
We are going to kill most of the tax credits for clean energy. It's just horrible. And if you stop and think about what Trump's doing in terms of our economy, the impact on climate change is really bad. But I mentioned the impact on electricity generation. Cheapest form of electricity now is renewable energy. If the tax credits die and a lot of these projects have started end, we're seeing electricity usage spike because of AI and other things. We will not have the capacity to meet that. Prices are going to skyrocket. Tariffs are going to lead to prices skyrocketing. Taking employees away from all the businesses that rely on them, including our farm sector, is going to lead to inflation. The deficits are going to, in the short term, overheat the economy, which will lead to inflation. You don't create big deficits when unemployment is 4% without having inflation. We're going to see a major spike in inflation, and when the Fed tries to stop it, we're likely to see in a couple of years we're going to be heading into a recession. This is such an economically damaging program. I don't know any reputable economist, whether he's a conservative or a liberal, who is looking at this bill and saying this makes any kind of sense. It just makes no sense at all. As I said, this is the product of Trump's imagination and his bigotry and the nonsense he's believed back since became prominent in Queens in 1978. The guy doesn't understand this stuff, and no one has the guts to tell him he's wrong. Not his staff, not the Republican members of Congress, no one. And that's why we're stuck with this. And it's going to hurt our economy badly. And that will also, and that may happen, that will happen even before I think the Medicaid cuts take place. So all this stuff is going to happen, and it's terrible. Jeff, you're muted, Jeff.
Sorry, I thought I unmuted myself. Question from Alex. If the bill is passed, how would states like PA be prepared to respond to the gap in federal funding availability for programs like Medicaid and SNAP?
That is a very, very good question, and it's a question our team is been working on. At the moment, given the state of our budget, we do not have the capacity to replace very much SNAP or Medicaid funding. In fact, if the state is required to pick up 10% of the cost of SNAP, I don't think we can do it. That's $400 million a year. And what that might mean, even if it's $200 million a year, if we can only pay half of what's required, the program gets cut in half. That means 1 million people lose SNAP. On the other hand, the state does have the ability to raise taxes on the very rich people who are getting an enormous tax break under this bill. And I firmly believe that given how bad this is going to be, our General Assembly needs to raise taxes on the richest people in Pennsylvania. And it can do that. I know you've heard about the uniformity clause. There's a way around the uniformity clause. We've been talking about it for 7 years, called the fair share tax. We can create a wealth tax. We can raise the revenue to replace a lot of this federal funding temporarily while we're waiting to get the federal government back moving in the right direction. And our organization is going to be putting forward some ideas sometime this summer, about what we can be doing and should be doing. We've been all saying the state can't do it because we're trying to make the strongest possible case against this bill. It's going to be hard. We have to get our governor willing to propose these ideas. We have to get our House Democrats willing to support it, and we have to find some way around the Senate Republicans, who I'm sure will block this stuff. But it's certainly not impossible. And I think it's incumbent on our General Assembly to protect the people of Pennsylvania who are being hurt by this legislation, and make the rich people who are getting benefits they do not deserve pay for it. Yeah, Jeff.
We had another question here. Question from Monica. This has to do with healthcare and Medicaid and other services. People with disabilities who have home healthcare workers. With all that's going on, will that be taken away?
Not immediately. The bill doesn't actually require that. But as the state has to make cutbacks in Medicaid funding to protect some, the state's going to have to make very difficult choices if we don't raise new revenues to help this group or that group hurt by Medicaid. And that's one of those services that is not required by the federal government. It's a state choice. So I am worried about some of those things being cut back. Obviously, we're all going to have to work very, very hard to protect the people who will be made vulnerable um, um, by those kinds of cuts to Medicaid. I don't, I actually think we have the political will to stop it. It's going to take active legislation, and I think the governor and the House Democrats could veto any legislation that would do that. Yeah, Jeff.
Another bigger picture question here from Jennifer, and I think this is a question that a lot of us are asking themselves. Jennifer says, am I naive to think we can undo this monstrosity in a few years?
It's going to take a Democratic president, a Democratic House, and a Democratic Senate. We're going to have a Democratic House after the 2026 election. By the way, anytime I talk about creating a Democratic House or a Democratic Senate electing a Democratic president, I'm making an observation. I'm not calling for that to happen. We're a C3 organization. We don't take partisan stands. I'm just making an observation of what it's going to take. I'm sure we're going to have a Democratic House in 2026 if we have free and fair elections. I'm fairly sure we're going to elect a Democratic president in 2028 with the disaster that's going to befall us because of this legislation and the other stuff Trump's doing. The Senate is a little tougher, but it's not impossible. I think there are a couple of Senate seats that Democrats can win in 26 that will get us close. We're only like 3 seats behind, and there'll be others in 2028. And if things are as bad as I think they're going to be, we could see a real change. And then if we get a trifecta, and if they immediately get rid of the filibuster, we can undo all of this in months, maybe months, 9 months. It's not impossible at all.
I see one more question here from our friend Jeff, who's asking, and this is again related to the Medicaid implications for Pennsylvania. Jeff's question is, how about folks who are enrolled in Penny, the state health exchange? What will happen to them?
One of the things we haven't been talking enough about, just because you can't talk about everything, is they're not just rolling back funding for Medicaid. The expansion of the tax credits in Penny that President Biden put in place has really helped huge numbers of people in Pennsylvania. We're expecting a loss of people on Penny because those tax credits go away and health insurance is going to be unaffordable for them. In some cases, I had an example. I'm not sure I'm going to remember it off the top of my head, but for like two people who are 60 years old, the additional tax credits are saving them like $12,000 a year. When those tax credits expire at the end of this year, their health insurance is going to go up $12,000 a year. And there are a lot of people. We're talking about working people. We're talking about middle class people with fairly high incomes, and they're still not going to be able to afford that health insurance. So the attack on Penny is really bad. This is frankly a repeal of about 3/4 of the Affordable Care Act. We ought to remember that. And let me say one thing about healthcare. When people say, if you ever hear anyone who says, "Oh, we shouldn't be funding those people who aren't working on Medicaid. We should make them work." Look, there is no one in this country who gets health insurance without government support. Absolutely no one. And no one gets health care without government support. If you work for a business, you get an enormous tax break on your health insurance that costs the federal government far more than the Affordable Care Act, subsidies at least. If you buy insurance yourself on the ACA, you've been getting subsidies. If you're on Medicare, you're getting subsidies. If you're on Medicaid, you're getting subsidies. The idea that this group of able-bodied people, 19 to 64, should not get health care as a right is just insulting. And the fact is, most of those people are working. So when they say we're only taking away from people who don't work, that's not true. There are lots of people who don't work who get government subsidized health insurance, and they deserve it. We all deserve it. I want to leave enough time for Dwayne to talk about the hometown fight back. So if there's one more, Jeff, did you think I really ought to?
Yeah, I had one last one that I had queued up for you if we had time for it. From our friend Sean, who's a real advocate for children and their well-being. Sean's question is, Mark, and this is, again, talking a little bit about the tax breaks, which we like to talk about here. The other side of the state budget is that all these tax breaks on projects, there have been all of these tax breaks to attract businesses to Pennsylvania. If we stopped all of those incentives and those tax breaks, what holes would that plug? I think the question is maybe how much could we raise if we hadn't phased out some of those taxes?
I don't have a number off the top of my head about how much we would raise. Some are going to go away because we're giving big subsidies to hydrogen plants in Pennsylvania, but there aren't going to be any hydrogen plants in Pennsylvania thanks to that. May be the only good thing about this big budget bill is that it will make some of the states' subsidies for energy projects that we shouldn't be doing impossible. But yeah, I don't have a number off the top of my head. I'll tell you what, the biggest thing we should close is the Delaware loophole and the Bahamas loophole that lets corporations that operate in this state escape from any corporate taxes. That would raise, if we did it the right way, it could raise $1 billion a year. We're going to come out with a paper that explains how Pennsylvania could raise $4 or $5 billion a year while cutting taxes for working people this summer. It's totally doable. We just need the political will and the right people in office. All right, I think we better turn it over to Dwayne and so we can talk about the hometown fight back. Thank you all for all those questions and for listening to me. I appreciate it. And for all that you've been doing for so long. Dwayne, is your internet okay?
Yeah, I think so. I'm going to stay off camera though, because it's been really in and out, but that's a good segue. The work that all of you have done, I see you all here. I see your names in the chat. I see what's going on. We've met with so many of you, and that since the beginning of this year, we have done over 90 events from one end of the state to the other. Everything from a bus tour to these statewide calls to community conversations to die-ins and just a whole list of events that we have talked through, press conferences and so forth, collecting stories, sharing them through social media. I dropped in the chat a few times and want you to consider this because one of the things we consistently heard as we went across the state is we felt that our elected officials were not listening to us. The fact that this campaign has gone on this long because this bill was supposed to be passed in January is a testament to all of your work. But we wanted to make sure that everyone was empowered to be able to do and to jump in and to have their voice heard as much as possible. And that's one of the missions of the Pennsylvania Policy Center, Pennsylvanians Together, is to make sure that we can provide the tools to help you to live in better communities. We should all be living with dignity. We should all have a bright future in front of us, and we can do that when we come together. So we have a program called the Hometown Fight Back. And I'm not quite sure what that looks like for you. What it looks like for you could be maybe a little bit of help with putting together a house party. Maybe it's help with a TikTok. Maybe it's organizing a local vigil. And also, folks, while we're talking about this, I've been hearing some things just today about the potential response to this bill passing. I know we have a holiday in front of us, but I've been hearing some things about maybe on Monday showing up at your local elected official with a noisemaker, with a sign, with something. If anyone here on this call has heard any more about those things, please drop it in the chat. And I know that I'll be checking our socials as we move forward. And as I hear them, I'll make sure to update it on our Facebook page, on our Twitter, on our Blue Sky, on our social networks too, if those things come up. But what I'd like for you to do is consider having a hometown fight back and what's most important to you. There's a reason why you're on this call. And there's a reason why you are concerned about your family and your neighbors. And we want to help lift up that voice. So by clicking on the link that I provided, you can fill out a very short form that tells us why you're in this fight, why this is important to your community, and how you would like to fight back. And we want to be able to support you. Since we launched this, we've done several events in different parts of the state around this. One of the things that we're going to be launching, there was quite a number of studies about the impact on local hospitals, and if there are and the challenge. I mean, if you live in Pennsylvania, you're not going to say, "Oh, our hospitals are very stable and we have great health care, and I can see a doctor when I need to do it." Right? Like we all know what hospital closures look like in this state, and it doesn't look any better. There was a recent article about 5 hospitals, for example, in Western Pennsylvania that are on the brink of closing. And I know that there's some here in the Northeast as well. And so on Monday, we're going to be sending out, after the dust clears from this, so we think, another invitation to all of you to join our hometown fight back. And particularly around hospitals, we're thinking about engaging with folks because we know that that's really important, but it could be about anything. So if you have some questions, we're going to be saving the chat. Thank you, Jess, for posting that article, which lists those hospitals. There's a die-in. Okay, good. Well, I'm going to save the chat, make sure we have this. Adrian will back it up for us so that we can kind of sort through, and we'll be lifting up these various events that are going on. But this is how we fight back. This is how we hold elected officials accountable. This is how we help to mitigate the bad parts of this bill as much as we can, is by coming together. And so once again, I'd like to thank all of you. I'll drop it once again in the chat so you can click on that link to sign up and fill out that form so that we can get you on the record of wanting to do something in your community, in your home, perhaps, maybe in front of your legislator, maybe do an empty seat town hall, whatever it might be. That's how you go about doing it. And we'll do that. And also, I want to take this opportunity to talk about what we have coming up. So Monday, you'll receive an email about any events that are happening, and also the federal fight back once again. And Jeff, I know you have another call that's coming up, so I'm going to flip it back over there. It looks like I made it through this conversation without freezing up. So I consider that a victory, and I'm going to turn it over to Jeff.
We're going to do a Kickstarter to get Dwayne better internet.
That is one of the things that was part of that infrastructure law that went into effect, is to expand our broadband. To help out with that for Dwayne. Very quickly, 2 weeks from today is the third Thursday of July. Third Thursdays at 1 p.m. is when we host our state policy action Zoom meeting. This one is focused on federal issues. It's the first Thursday at 1. So I would invite you to join us here 2 weeks from today, same time. We'll have a different login. We don't have that available today. We will get that around to folks with follow-up materials. But we will be taking a very close look at what's going on in our state government. As some of you know, the fiscal year for Pennsylvania began at midnight on July 1st, on Tuesday. Under the state constitution, we're supposed to have a balanced budget in place by that time. As you know, if you've been paying attention at the state politics, we don't have a state budget in place. And at this point, it looks like it could be a couple of weeks, could be maybe several months. We're not sure yet, but we're going to keep a close eye on it. There are some very important things at stake here. One is obviously, how are we going to respond to these federal attacks on healthcare, on food? And we will talk a little bit about how we can raise the revenue to fund the things that we need here in Pennsylvania. And then, of course, there are the other issues that are getting a lot of scrutiny and a lot of concern in terms of the state budget: school funding, funding for public transit, a host of other issues. So our focus is going to be on the state budget. That will be 2 weeks from today, Thursday, July 17th, 1 p.m. We'll send that around, but please join us, because we will be talking kind of the other side of this, which is, how do we as a state, what can we do to fight back? On that note, I'll turn it back over to Dwayne, and I'm ready to wrap up.
Thank you, Jeff. Once again, thank you, folks. Please stay involved. Take the time that you need over this holiday weekend. This work is hard. It has incredible impact. And I know you all try to find the joy in it. I encourage you to do that, and looking forward to partnering with you and helping you through this time. We're here, we're going to be here, and we're going to be able to help lift up those voices. So look forward to being in touch and from hearing from you. Thank you for joining us for today's call.
Thank you all. See you soon.